Second, first, we want to tell you 2 mosquito pools in Ottawa County have tested positive for the West Nile virus. The health department said it's continuing to monitor the situation closely through surveillance. Health officials also say these types of positives are common. They're simple things you can do to stay safe from mosquito-borne illness.
We always recommend mosquito spray, wearing long sleeve shirts, just something so that mosquito can't bite you, through the bare skin. Obviously, the best way to prevent mosquitoes is reduce or remove any kind of mosquito breeding area, so anywhere that stand in water.
The most at-risk groups are seniors and children or those with weakened immune systems. Health experts also point out that fewer than 1% of people infected with West Nile virus develop a serious neurological illness.
This morning, a local woman is urging you to take precautions after her husband of 30 years died from the West Nile virus. Duranda Hops says her husband, Gary, died June 29th at his home in Springtown, that's in Parker County. But just 3 weeks earlier, he was fine, working in the yard, mowing the lawn. She says it was the last thing he did before his health started to decline.
And then he went to work on Wednesday morning, and about an hour in, he said, "I have to go home. I'm not feeling well."
Now, after he was admitted to the hospital, she says he was unrecognizable in just a matter of weeks. And he could be the first person to die of West Nile virus this year in Texas, as we are waiting for the state to confirm that. Experts do recommend using bug spray, getting rid of standing water, and avoiding time outdoors around dusk and dawn to avoid those mosquitoes. That time is when they're most active.
Something to watch out for this summer as the mosquitoes start biting: dengue fever. Cases of the mosquito-borne illness are rising across the country, with the CDC issuing a health advisory just last week. Here to talk about the dangers of this illness is infectious disease specialist Dr. Dee Banks. Thank you for joining us.
Thank you for having me.
Yeah, we know dengue fever is from mosquitoes, but what exactly is it, and why do you think we're seeing an increase so far this summer?
Well, dengue is caused by a virus, and it's spread by mosquitoes, and that's what we call the vector. That's how it gets from one person to another. The mosquito bites an infected person and then goes and bites another person, and that's how it's transmitted. And I think probably we're seeing more of it because, we keep bringing up that word about climate change and global warming. If you look all over the world now, especially in some of those areas where dengue is endemic, we have a lot more rainfall. Look at the Caribbean now with the Hurricane Beryl that's, barreling down on them. So our climate has changed, and these conditions are more conducive for mosquitoes like this kind of environment.
Okay, now the cases spread here to the U.S. They're in Florida, Massachusetts. What about people here in Ohio, the Valley? Should we be concerned?
Well, there are 2 ways of acquiring dengue. One is locally, and that's primarily more in areas like Texas and Florida and the southern areas, the Gulf Coast area. And then there are those that bring it back after they travel. And so in terms of us in Ohio, I don't think we really have to be too concerned at this juncture about us locally acquiring dengue. First of all, if you've noticed, it's kind of cold here. So mosquitoes don't like that. But I think I want to say to those of you, this is big vacation time. And those individuals who are going to like areas in the Caribbean or Puerto Rico was seeing a rise. And some of those areas, I would pay attention to the alerts that the CDC and World Health Organization puts out. Be careful.
Okay. Now, how should you protect yourself? Should you bring wipes, wipe things down, wear bug spray? I mean, what's your top recommendations?
Well, my top recommendation is bring an insect repellent that's been approved by the Environmental Protection Agency. And I always tell everybody one that has DEET, DEET on the label, and that's your best bet. I mean, there are others, but you have to make absolutely sure that it's approved by the EPA. Wear long sleeves and long pants, and just if you're in one of these areas like Florida, we're not, but I tell people you have to watch out for stagnant ponds. A lot of people, when it rains, you don't empty your pots out, and these are all areas that mosquitoes congregate around.
Oh yeah. And lastly, what are the symptoms people should watch for should they somehow contract this?
Well, it's probably not unlike a lot of other viral illnesses, and this is one. If you've been in an area where dengue is prevalent, you need to see your doctor. If you have symptoms of fevers and headaches, sore throats, even, and joint aches and pains, and things that are just out of the ordinary, and you've been to an area where dengue is prevalent, it's time for you to see your physician.
Absolutely. CDC issuing that health advisory just last week. It's making headlines this week. So Dr. DeBanks, thank you so much for giving us your expertise.
Thank you for having me.
Health alert tonight. The CDC issued a warning after several people in the U.S., including in the tri-state area, got sick with a mosquito-borne virus traveling. It's called dengue. It can take up to 2 weeks to develop. There are currently 142 cases in New York, 41 in New Jersey, and 6 in Connecticut. Now, symptoms include headache, nausea, vomiting, rash, muscle and joint pain, and minor bleeding. The CDC is urging people to wear insect repellent, long sleeves, and pants when outdoors to prevent getting bitten by a mosquito.
Governor Polis says the avian flu outbreak in Weld County is now an emergency. The governor making that declaration so state offices can assist in the response, recovery, and mitigation efforts. It also unlocks the funding and resources to help affected poultry facilities contain the outbreaks. This comes as a Colorado man actually recently tested positive with the virus. He has since fully recovered. Multiple cattle have also been affected.
A health alert from the CDC. A 4th person has contracted the bird flu, this time in Colorado. Since April, 2 cases were reported in Michigan and a 3rd in Texas. The cases are all linked to an outbreak of bird flu among dairy cows. As each of the patients are dairy workers that were in close contact with the infected cows, the CDC says that while the risk of infection is low for the general public, you should stay away from sick or dead animals and anything that they could have touched.